Hi, Zenon. My name's Danielle. I'm going to be your respiratory therapist today. I just I read through your chart and I saw that you were being freshly diagnosed with asthma. And I just wanted to say I'm sorry, and I know that can be a challenge, and but with the right treatment and you staying on your preventative measures, you can, hopefully we can get you out of the hospital and back to your normal life. So I'm going to do a couple things today, but if you could just verify your name and your date of birth for me first.
Zenon Gill, March 3rd, 93.
Awesome.
I go by Bob, though.
Okay, Bob. Sorry. So before I start, I am just going to go ahead and take a quick listen to you, okay? If you could just take a deep breath in and out. Good. One more time. Deep breath in and out. One more time. Deep breath in and out. Deep breath in and out. And then, sorry, one more over here. Deep breath in and out. In and out. And then one more time. In and out. In and out. Awesome. Sound pretty good. Okay, Zenon, so an important thing that you're going to have to be doing from now on is using an MDI. It's a form of medication, and the one that the doctor wrote for you is called albuterol. So you're going to be using it in this and what is called a spacer. I'm going to show you how to use them. I'm assuming you haven't used these before?
I think my friend has one of those.
Okay. So we're just going to go over the proper way to do this. And if you have any questions, please ask, okay? So this is what your drug will come in. And it has like a canister like this, and you put it here. And then it has a cover. So when you go to take your cover off, just make sure there's no dust or anything hanging out in there. If there is, just wipe it out real quick. You want to prime this every 24 hours if it hasn't been used. So to do that, you just shake it, and then you just spray it once, and it's primed and ready to go. And then you're going to use it along with this, which is called a spacer. So if you try to use your inhaler without your spacer, the medication's just going to sit in the back of your throat, and it's really not going to get deep down into your lungs where we want it to go and work. So to use this, you're just going to connect these here and put this one here. And then this is your mouthpiece. And you're just going to open this. And then same thing, you just kind of want to look in here, make sure there's no dust or anything gross hanging out. If there is, just wipe it out. And so after it's primed, what you're going to do is you'll go ahead and push and administer the drug. You're going to take a nice, normal, slow, deep breath in, and then you're going to try to hold for 5 to 10 seconds if you can afterwards. Usually in between doses, you want to wait maybe a minute or so, and then you'll usually do another one. The doctor wrote for 2 puffs every 4 hours. So we'll go ahead and do it once, and then we'll wait, and then we'll do it again. And then after your 2 puffs, if you need to cough, go ahead and do that. And then also when you go to put your mouth on this, try to get a nice tight seal around there, okay? Mm-hmm. Do you have any questions about using this?
So a nice powerful breath in.
Yes. And then go ahead and spray once for the medication, and then take your nice slow deep breath in. Awesome. Good job. Perfect. Okay. So we'll wait a few seconds here. You feeling okay?
Mm-hmm.
Okay.
Feel a little jittery.
Yeah. So part of this, some of the side effects you're going to feel from albuterol, that's the drug you've been prescribed. It's normal to cause a little bit of tremors, increased heart rate, so you might feel your heart starting to pound a little bit, but that's kind of normal for your side effects, so don't be too alarmed. And so let's go ahead and do it again. Tight seal around the mouthpiece. Breathe out. Go ahead and spray, and then hold. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. Perfect. Awesome. Great. So then when you're done with your 2 puffs, we'll kind of just pull it back apart like this. And then you'll cover this, keep this covered. And then usually you want to rinse your spacers out once a day or as needed. If you start seeing that it gets kind of gunky in there or foggy, you're going to want to rinse it out. And you can just rinse it out with warm water and soap and then just set it up to dry. The best thing that you can do to keep from coming in the hospital is using your medication correctly and as much as it's being prescribed. So it's just really important to stay on top of that so you don't have an asthma attack and you end up back here. And I know it can be really hard to manage all of this, especially when, you know, this is a new diagnosis, but please, that's what I'm here for. This is my job. So if you have any questions at all about it, please give me a call. My name is on the board. And I'll be back in a little while to give you another treatment. But if you're starting to feel worse or anything like that, please give me a call. Okay?
Cool.
Awesome.
Thank you.
So before I go really quick, I'm just going to take another listen to you. And then I will be out of your hair. All right, deep breath in and out. Deep breath in and out. And again. Okay. Deep breath, deep breath in and out. Deep breath in and out. Deep breath in and out. And then one more. In and out. If you need me, please give me a call. Otherwise, I'll see you later, okay?
Thanks.